ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. Welcome back to another episode of Beyond Graduation. I am Savanah Craig, and with me as always,
I'm Ronnetta Sartor.
We are happy to be back. This week, we are talking about, I don't know, is it controversial? Is it a hot topic? How to describe it? So this one came up, another look inside our ever-growing text thread. But this idea of dentistry, the way we present our like reworks or redo or treatment failures, all of these are various words to describe the differences in how we look at rework, redos in dentistry versus medicine, and how this has changed, this perspective changes over our career or personally day to day and hour to hour, how I'm feeling. But Ronnetta, share with us your thoughts. I think you've matured into a different perspective over your career. So,
are you calling me old?
Maybe
just a little
wise, mature,
seasoned. This is a great topic, and I think part of what sprung it is I think you sent me a social media post. And it was a post in which a dentist was doing work on one tooth, and a tooth that they had spoke with the patient about right beside it broke during the process of taking the tooth out. And, the question was posed, do you charge for the work on a tooth that broke while the other tooth was coming out? And so it just kind of sparked conversation on social media, but then outside of social media, Savanah and I talked about it. And so when Savanah and I were talking, I was like, well, I think earlier in dentistry in my career, my thought process was, well, if it broke while I was taking out the tooth, then it must have been something that I did. And so if I did it, it's like if you break it, you buy it, right? And that's how I thought about it, right? So over time, I have evolved in, my comprehensive exam. And so my first time ever meeting a patient that has a comprehensive exam, I'm looking at everything and telling them anything that I see that's currently a problem or anything that may be a potential problem in the future with their permission. If I don't have their permission, I'll just simply say, hey, there are some things going on in your mouth that has me concerned. Whenever you're ready to talk about it, I'm here and I'd love to have a conversation with you about it. And so early on, I like to plant the seeds that, okay, there are things going on that will need to be addressed in the future. And I think in doing so, now, if I have a tooth that had some issues, we're taking out a tooth, I think there would have by that point been multiple conversations or references to this tooth being at risk to where I would not feel like if I break it, I buy it, or feel that I broke it, to have to buy it, it will be more so a conversation. Okay, hey, we talked about this tooth, it's not looking good. We need to go ahead and move forward doing treatment on that tooth. Or, if the patient at that time doesn't want to, we talk about risks associated with no treatment either. What are your thoughts? Where are you right now? Are you the if I break it, I buy it right now?
Probably lean more that way. I'm trying to get out of it. Couple of factors, I think, because I've been thinking about this a lot since we've been texting. I think the more dentistry I do, the more mouths I look at, the better I'm getting at seeing those potential problems and bringing it up. Or at least, like you said, planting the seed that there are other concerns brewing in these areas. So when I do that, I feel better about charging for treatment that is needed additionally. Sometimes you don't know what might happen to the tooth next door. And I think a lot of this is just because I'm so new to dentistry, you don't always know the possibilities. So that's one reason I think I'm more prone to try to smooth things over. To play sort of devil's advocate, we are in just a world of Google reviews and litigation. And as a society, we're more prone to, I don't know if anger is the right word, but blame maybe. It's hard for some people to take responsibility and trying to give that responsibility to the patient and not to you. Sometimes, honestly, I'm just like, I just don't want to deal with the potential repercussions, and I will eat the whatever lab cost of this crown and my time to smooth it over. And maybe that's not the right perspective to have, but there are, then that's what I mean by day to day, it changes and different patients and different things like that. But genuinely, there are times where just like, whatever, I'll just do it. And it's probably not always the right answer, but sometimes I just want it to be over.
Yeah, I think it's time and place too, right?
Yeah.
I think the more, in your words, the more old or more seasoned I get in the profession, the more I learn the importance of over communicating with our patient.
Absolutely.
So if during that comprehensive exam, or let's just say it's a limited exam, and a patient comes in on one day just for an extraction,
Yep.
and I look around and I see that there's a lot of recession, there's a lot of decays, a lot of stuff. I plant the seed then. But let's just say you mentioned a crown remake or something like that, right?
Right.
Let's just say that, patient came in before the crown was needed, and we see there's a lot of erosion in the mouth. We see that they have dry mouth. We see that they're on a whole lot of medications and all these things. We're going to have a discussion about, okay, here are all of the things that's putting you at higher caries risk. Here are some of the things that we could do to mitigate it. And as you know, there may be some situations where it's an uphill battle and we may never be able to help with the xerostomia that's medication induced. All we can do is try to slow it down.
Yeah.
I think that's a discussion that should be had with the patient. And if that crown that's needed on that tooth fails, the patient should have some accountability in that too, if that makes sense. Like
Absolutely.
it's more so like making a transition now. Don't get me wrong, there are some situations where I'm like you, okay, I'm going to honor my work. If a crown broke and it's because I under reduced, that's on me.
Sure.
Yeah, I'm going to remake it,
Right. Or, hey, this margin isn't as good as I want. We're sending it back to the lab.
Right. Or if, I do a composite restoration and I'm in hygiene and I see that I don't like how the margin looks or there's an air bubble in it, I'm going to redo it at no charge to the patient. Apologize to them, tell them all I need is their time and I will make it right. But if it's a situation like what we talked about, a lot of it is the more you over communicate, the more, not that you won't have any pushback, but I think it becomes less of a thing because when things happen, patients remember, oh yeah, I remember you told me that. Or I know in a previous episode, we talked about documentation.
Yep.
Intraoral photos, and now we have scanners where we could take a scan and compare it to what it looked like 6 months ago and let our patients know, hey, it's breaking down. This is what it looked like 6 months ago. This is what it looked like today. We need to do something.
And documenting the conversation in your clinical notes as well, because if it is not in your note, it did not happen.
Very true.
What about, I'm going to play devil's advocate here. You over communicate, you talk about all the risks. Okay, first of all, you cannot talk about all of the risks. Do you know what I mean? If you did, nobody would do anything ever. 2, I don't always know all of the risks. Weird things happen sometimes. And 3, people don't always listen to me when I tell them everything. What do you do in those situations? Because for me, sometimes I'm just like, I know that I told you, you're going to fight me, or I don't know why this weird thing happened, honestly, because I have only been doing this for 2 years. And honest communication in those moments, but sometimes it's just like, here's your refund and let me get you in the hands of somebody who can help you better than I can.
And I think nothing's wrong with that.
Yeah.
You get what I'm saying? If there's a disconnect and I'm not getting through to you, or if the patient's communicating with me and they're not getting through to me, then you're right. It's okay to give that refund. Because I mean, over time I have learned that too, right? Like, if there are red flags there, or if we're just constantly not on the same page. Overall, I care about my patients and their health, whether it's their oral health or, just overall systemic health, right? And so I want them to get the best care possible, even if I'm not the person that they're getting it from.
Yeah.
Yeah. So at some point, I think you're right. You have to make that call,
Yeah. I think, why do you think dentists do this? Because medicine doesn't do this refund thing. Even if I have a patient whose family member had like a knee replacement and it became horribly infected and they've had to have all of these revision surgeries, and I mean there were talks of like potentially like amputation and things just because of how bad this infection had spread. And that's just a freak thing, right? And I tell patients this all the time, like there are just risks and complications to everything, but especially healthcare, that we just can't even plan for. But in dentistry, we take that on ourselves, and I don't know why we do it.
Yeah, I'm not sure. I'm honestly not sure. It's a very good question to pose, like I think a lot of it too is being honest with ourselves and being honest with the patient, right? I can go to all of the CDE in the world, right? But I don't think I'm ever going to be able to replace something better in form or function than what a patient originally was given by God or whoever we may believe in, right?
Sure.
I'm not God. Like
Yeah,
I can't,
right.
I can only do but so much. And I think part of it is, having that conversation with patients about expectations,
Yeah.
and over communicating that too. But you bring up a very valid point. Like if we do a filling and the filling breaks, some of it might be the difference in medical insurance versus dental insurance, right? And
Sure.
so we know that if a filling needs to be redone, insurance isn't going to pay for it on average,
Yeah.
but every 5 years or something like that, right?
Yeah. Good point.
And so it could be that as dentists, we're like, we want to honor our work and we just eat that cost,
Oh, I wonder if part of it too is just, I don't know if education is the right word, or the public, if you need a hip replacement, right? But you don't always know that you need a crown.
Yeah, I think you bring up a very,
And so I don't
very,
know
very good and important point. I think it's value, right?
Yeah.
If I'm in so much pain that I cannot walk, that's greater value than me getting a crown put on a tooth.
Right.
Because I'm likely still, for the most part, able to eat, right?
Right.
I'm able to function still. So I think a lot of it is, I think we still live in a time where oral health is not valued as much as like systemic by society. For example, like sometimes we'll be the only healthcare provider that some patients will see if they're coming every 6 months. We'll see them more frequently than other people.
Yep.
It goes back to like the mouth being a gateway that shows what's going on with the rest of the body. But I think in general, some people still think that the mouth is aside from the body,
Yes.
and it's not all connected.
Yep.
What do you think?
No, I definitely think as a society we've separated. I mean, medical insurance and dental insurance are separate. Our schooling is separate. We just believe it's separate, but also teeth are weird in that, like, think of a necrotic tooth. It hurts and then it stops hurting. And
That's true.
and sometimes teeth get sensitive, right? And they hurt for a little while and then they stop and they're totally still fine. But then other times my tooth hurts really bad and then it stops hurting, and that's because it's dead and infected. And teeth are just weird. I saw this video on Instagram today about, it was some song about how teeth are the bones outside your head, and it was just like this whole comedy thing. And I was like, they're super weird when you think about it. Like the existence of teeth, but then also just like the nerves. So I think they're an enigma to people too.
Yeah, because think about it. Enamel, right? For example, is one of the hardest, is one of the hardest surfaces in the body, right?
However,
if once it's gone, it's gone. Like, we can't grow it back for you. We can do some work for sure, but we can't grow back.
yeah, it's the other thing that I think is so hard is, and medicine as a whole, I guess, is this way where we are spending less and less time with patients just because of the way things work, but trying to explain everything that I know in here in a way that resonates with people, makes sense to people, and discusses all the multiple factors going on here is really hard. And again, sometimes I don't even know. And so I think it's so easy to take that responsibility on ourselves as the dentist. And I was having a conversation with a classmate and good friend of mine about me personally. I am prone to imposter syndrome and immediately assuming, oh, I didn't do good enough here. And trying to get over that in my own head, because I'm sure whether I know it or not, the way that I talk to my patients has that in it. You know what I mean? Whether I mean to put that out there, there is that bit of intention in my own brain. And so I think the more that you practice and the more that you see your work, the more you know where that responsibility lies, I guess is.
Yeah. I think I maybe was where you are right now, out of school. And I went to a lecture, and it was Dr. Leanne Brady.
We love Leanne Brady.
I know. And she had a lecture about like complications in dentistry. And one of the things that she has said that has stuck with me to this day is that we have to start realizing that the dentistry failed. It's not that we failed. And so, like, it's one of the things that still resonates with me. And I think piggybacking off of what you said earlier, too, about like how do you communicate it to the patient in a way that resonates with them. And this is Dr. David Rice. He always talks about knowing what our patients value and what's important to them. So if someone values spending time with their grandchildren, and they have a vacation with their grandkids coming up, well, you don't want that to start hurting you while you're on vacation. Let's try to get it taken care of so that you can spend the time that you want with your grandkids. And it's not saying that in a way that makes someone feel bad for not doing treatment, but it just says it in a way of that makes them think, oh, you know what, I do value that, and I don't want to have to call you to hope that you could get to me when I'm in crisis, if that makes sense.
Absolutely.
I don't know, this is a really good topic. We could probably talk about it all day, really.
Absolutely. Yeah, I would love comments and thoughts from people, because I do think this is a hot topic in dentistry, and it's definitely a situational thing as well. Like, I don't think you could blanket and say I never.
Yeah, I definitely can't say that. I definitely can't say that I never, because I think certain situations, I would, and I would honor certain things. But I think it has been something, it has to be something where I'm like, yeah, I can see that.
Yeah. But I'm going to tattoo the dentistry failed, you didn't fail across my forehead.
I think we all need to, though, because we take it personal.
I think we should circle back to that at some point, because I do wonder what in our like dental education or whatever put that into us. But we could talk about this forever. So friends, let us know your thoughts on this topic and what you do in your office and when. And yeah, the dentistry failed. You didn't fail. Until next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr_Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.